I'm Nan Whaley, Mayor of Dayton, and I'm so happy to be here on this beautiful sunny day with my friend and mentor, Senator Sherrod Brown, and the great Gina McFarlane, who does great work along with Doctor here to really celebrate first, people getting vaccinated. Again, you can just come to this site and walk right in, get your vaccination. It's super easy. If you remember, I got Johnson & Johnson last at the end of March. No side effects whatsoever, but a great way for us to really open up our community and save lives. Secondly, I just want to mention how lucky we are to have the American Rescue Plan. As Gina and I were discussing, the amount of money that Five Rivers Health Center will get through the rescue plan is unprecedented for her and her time. It's unprecedented in the city of Dayton, and the child care tax credit that will bring at least half of our kids out of poverty in the city of Dayton is transformational for us to come out of this pandemic and make sure that our kids and families have everything they need. So we're really excited to be here. The fastest way we can get there is for everybody to get vaccinated. We're encouraging everyone to come, get it done for yourself, for your community, for the people that are older in our community. We need you to take this step. It's easy, makes sense. We've all been vaccinated up here. We're not telling you to do something that we're not willing to do, and we're excited to do it. So I hope everybody will do that. And with it's my honor to introduce a great friend of Dayton, Senator Brown, and we're excited as he's taken his tour that he's ending it here in Dayton this past week. And Sherrod, we're just so happy that you've decided to come here to Five Rivers.
Thank you, Nan. Thank you, Mayor. Thrilled to be here. Good to see all of you, and I mean that in every way. I haven't seen Gina in a year. I haven't seen Mike King in our office for a year. I haven't seen Rachel in our office. Well, I've seen her for 3 days, but not for a year. My office has been working remote for the since March, a year ago, and everybody in our office, I believe, has been vaccinated, and we feel that we want to get out and do our jobs the way we have. And special thanks to the camera people who really are essential workers. I mean, a lot of us have been able to work at home, but grocery store workers haven't, and people doing the news haven't. They've been out among people with the anxiety of returning home every day to their families, potentially exposing them. So I remember one grocery store worker said to me, "They tell me I'm essential, but I really feel expendable because they don't pay me much and they don't protect me very well at work." And it's so important as we reopen and get and finally defeat this terrible pandemic that we recognize those people who have been essential workers and those that are returning to the workforce, and start to pay them better and start to treat them with the dignity of work the way that we should. So thank you for being here. This is a really big deal. As I went through the facility with Dr. Anim and with the mayor and with Gina, one of the questions I asked was, how are you doing in getting people back for their second vaccine? Some communities are not. I mean, they're getting most people back, but not everybody. In this facility, they're getting literally 99% plus people back. You go in for your first vaccine if it's not Johnson & Johnson, Mayor, as you know, and then you go back either 2 or 3 weeks later, depending on whether it's Pfizer or Moderna. And they get the appointment right away, and some people don't come back, and this facility has done terrific work in getting people back, and that tells me about their passion for public health and how it matters so much. So thanks to all the workers here that have played a big part in that. This is all part of the American Rescue Plan, to put shots in people's arms and kids back in school and money in people's pockets. It's working. We obviously have a lot more to do. We'll never get the economy back on track until we get close to everybody vaccinated, and we get people vaccinated. You know, a third of the public is a little bit reluctant, or more than a little bit reluctant. It's the kind of stories then when each of you talks to your family, and Dr. Kelly, all of you talk to your family and friends and say, you know, I got vaccinated, I got my second vaccine, I'm doing fine. We all need to do that. It's really telling the stories, and it's not just about any of us getting vaccinated. It's about people whom we love and what it means for them that we're vaccinated. And it really, you know, it matters what Mayor Whaley thinks. It matters what Dr. Fauci thinks. But to most people, it matters what their sister thinks and what their sisters react, how their sister did this, or their cousin, or their pastor, or their teacher, or their doctor. So lift people up, lift their stories up. It will make a huge difference as we combat this virus. And think of it this way. President Biden promised, the reason I'm so optimistic, President Biden promised at the beginning of his presidency that we would vaccinate 100 million people in 100 days, 1 million people a day. At the end of 100 days, we had vaccinated literally double that number, 200 million. We've had some days where we vaccinated 3 million people. So we know there's still a hill to climb. We know it's your stories that matter the most. And we know that when the president, at the State of the Union a week or so ago, he was telling the story of a nurse that she told him that every vaccine she administered was like giving a dose of hope. Every vaccine she administered was like giving a dose of hope. And that's what you as public health people have done. That's what you people who have given your lives to public health and to healthcare generally and to a healthier community. So my pleasure to introduce my longtime friend, Gina McFarland L., who always wears purple. I think you always do. She wore purple before the pandemic.
Absolutely. Thank you. Thanks everyone, especially Senator Brown for coming out today, and Mayor Whaley. We can't thank you enough for your support. We can't thank the public for trusting us to provide COVID testing as well as vaccine. Our goal is to serve everyone. We provide walk-in service, so we want to make it as easy as possible. Regardless of where you are, we're here to serve. Through the American Rescue Plan, we plan on serving even more. Our goal is to provide transportation, to provide more vaccines, more access to people who feel that they don't have it. And so our hope is that all people, regardless of where you live, regardless of what neighborhood you live in, you will trust the healthcare providers within just the opportunity to serve you. We know that we can do a great job, and we have done that here at Five Rivers Health Centers. We're especially honored to have you here because in 2 weeks, we'll be celebrating our 10th anniversary. As the CEO of Five Rivers Health Centers, we didn't realize we would get to be as big as having over 25,000 patients, 11 sites, and we're in the midst of opening up a brand new site in the Edgemont community. All of those things help us to serve patients more. And so with that, I would like Dr. Mamlia Nim, who's our Chief Medical Officer, who's led us throughout the entire pandemic, to help and serve us and guide us on what we needed to do to keep our employees safe as well as keep our patients safe. Dr. Nim?
Hey, doctor.
Hello, everybody, and thank you all so much for coming here. You know, standing here today, I go back to a year ago and the mood that we were all in across the country and in Dayton and at Five Rivers. We were in crisis mode. Everything was really dire. The roads were empty, and there was just no hope. So 1 year later, I was thinking about this and what has changed. The only thing that has changed is that we have a vaccine.
That's right.
That is the one and only difference between last year and this year, and the reason why things are moving around. People are moving and things are opening. So this vaccine is really, really important. Things are normalizing, but what we all have to realize is it's normalizing because people are getting vaccinated, and the people who are vaccinated are the ones who are safer out there. So as much as we're normalizing, we don't want to leave people behind. We want as much as possible for everybody who is able, 16 and above. The vaccines are now available, they're effective, they are at no cost, and they're safe. So anybody who is eligible to get that vaccine, because each and every one who gets it increases that normalcy and us getting there. Because the truth is that people are opening up, and what will happen eventually is people who are not vaccinated will start getting sick. COVID is still here with us. It's not gone yet. It's still here. But because people are vaccinated, it's reducing. So for us to get to that point where we can almost feel like it's gone, more and more people have to get vaccinated. And I understand the hesitancy. The important thing is we don't want to dismiss people's questions. We want to answer them. So if you don't want the vaccine, talk to people about it. Ask somebody who's had it. Talk to your healthcare provider. Talk to people and get your questions answered. We have 3 vaccines out there. And I want to talk about the Johnson & Johnson because I know that was a hiccup in the path. That vaccine is a single dose, and that's the great thing about it. And I think that the fact that the CDC pulled it and took a good look at it again means that safety is really, really important, and it's not being ignored. So right now it's out, and the guidance is there. There's a rare risk, small risk, but it's rare. So again, you don't have to take that vaccine if that's not what you're comfortable with. But there are 2 other vaccines that are safe that don't have that side effects. And it's still very safe to take the Johnson & Johnson. So have that conversation, keep having that conversation. We're all in this together. Thank you.
Thanks. Questions? One thing I wanted to say, one of the things that's really, that I know, and Nan and I have talked about this, that's really important during this pandemic is we really have seen how an efficient, effective government can make a huge difference in people's lives. The CARES Act kept 12 million people out of poverty. We're seeing the government come together with local, with FQHCs, federally qualified health centers, and others to do this right. And I was reminded of it as Gene and I and Nan and Dr. Annie were walking through, they introduced me to a group of pharmacists. And there's a program we did about 10 years ago called 340B. And it's to help places like federally qualified health centers buy drugs, prescription drugs, at a much, much cheaper price, kind of banding together and extracting that from the drug companies who never want to offer it at a lower price. And you talk to the pharmacists there, and Ms. McFarland just told me that it's been a lifesaver. It's saved so many thousands and thousands, hundreds of thousands of dollars, so they can provide other services in the community. So for all of these federally qualified health centers at 5 Rivers and across the country, this 340B has meant all the difference.
Absolutely.
So anyway, questions for any of the 4 of us?
Yeah, Senator, so you recently tweeted about the importance of keeping work here in the U.S. You tweeted about Walmart sending labor abroad. How is the American Rescue Plan going to keep labor here in the United States?
We are working on some bipartisan efforts on Buy America, especially for the infrastructure bill. There's simply no reason that when U.S. taxpayers pay for a project, whether it's building housing, or whether it's repairing a bridge or water and sewer system, there's no reason we shouldn't be hiring American businesses that employ American workers to do that work. So if there are times, we can't tell companies what to do, but we can tell companies if you're going to get public funds, we can tell them they're going to hire American workers. We are in the process of increasing the enforcement on international trade rules, that companies that move overseas don't get a tax break like the former president gave them to move overseas and then sell products back into this country. So we need to do all those things. Anybody else?
Feel good? Oh, well.
Can you talk a little bit about the partnership between the administration and Congress and federal qualified health centers in the future?
Yeah.
How that looks?
Well, more and more members of Congress are seeing, and both parties are seeing, the important role of federally qualified health centers. I mean, it was partly the expansion of Medicaid that not every state did. It was partly specific funding. We increased FQHC funding. People sort of interchangeably say community health centers or FQHCs. They're, I believe, exactly the same thing. Yeah. And we got a $10 billion increase a few years ago in direct funding. People, with the growth of 5 Rivers and what Gina just talked about, more and more elected officials, the community already knows it, more and more elected officials see how important these federally qualified health centers are, especially to do primary care, especially to sit. I mean, you're seeing that here. You're seeing if you can get somebody to talk to a nurse or a doctor, particularly a nurse, they're gonna get vaccinated because they have that trust in their healthcare professionals. And this center is the same thing. If you get people in here for primary care who are diabetic, they're going to talk to the pharmacist and the nurse and the doctor. We're going to talk to them about their diet. We're going to talk to them about their insulin. And it's going to, and that's what FQHCs can do that big hospitals can't sometimes. Sure.
Senator, how is Ohio doing in comparison to other states in regards to getting people vaccinated, getting people back to work, and strengthening the economy?
Ohio, because our legislature is reactionary and doesn't seem to care about public health and public education, we're behind. But I look at what we're doing, what the mayor's doing, what they're doing at Five Rivers and others, and we're doing a lot better than we would have without a state government that's been derelict in its duty and investing in public health and public education. I think our averages are roughly the same. They're better here in terms of second round compliance. As I said, 99%. I think statewide we're a little lower than that. Other states aren't as good as that, but that's because this is a particularly outstanding series of FQHCs, I think.
And how is the American Rescue Plan helping to fight food insecurity, which is its own epidemic in our own community and across the U.S.?
Yeah, we scaled up in the American Rescue Plan two things, really, maybe more than two. We scaled up assistance for summer feeding programs, assistance for school lunch program generally, understanding that many kids in this community, not far from here, eat better during the school week than they do on weekends, over Christmas break, or in the summers. And we've got to shrink that gap by being more generous with these summer feeding programs. Second, we increase SNAP benefits. And third, most importantly, we passed something I've been working on for 8 years. We increased dramatically the child tax credit, fully refundable child tax credit. So low-income family, literally 92% of Ohio kids will get help from the child tax credit. Some will get a portion of the $3,000 a year, or if the child's younger, $3,600 a year, $300 a month. Some will get the entire $300 refundable, and that will make a huge difference for poor families. One woman, I did a sort of a dignity of work discussion with a group of workers nationally the other day as chair of the Banking Housing Committee. And one woman said, came from a coal field in West Virginia, and she said, they call me working poor, but working and poor shouldn't be in the same sentence. I mean, people that are working so hard should be able to have enough to get by. Food, health care, housing, and we simply fall short. The right wing has stopped us from raising the minimum wage and killed the overtime rule. We need to do all those things. All right, anybody?
Thank you.
Thank you all. Good to see you. I'll stick around a little bit. Okay. Good luck. I'm done harassing.